19 deaths.
Yes.
That means over 1,000 people have survived this. So let's talk about the chances of survival, so that people who may have some of the symptoms don't go hiding or go into other places than the hospital.
Yeah, I mean, there are two kind of chances we need to talk about. We talk about chances of survival. We also need to talk about the chances of you even getting it in the first place. The figures that were bandied about at the beginning, 90% death rate and so on, you have to look at the circumstances. These occurred in countries that have worse health systems than Nigeria. They occurred in very distant rural areas because, as is known now, these things usually come to the humans from animals. They start off, so it's in a farming village or in a rural area. And then the way the virus used to behave, it has changed a little bit. The same way its holiday resorts have changed, its actual behavior seems to be a little bit less virulent than before. So what the viruses will do is they come out, they infect a village, kill people so rapidly there was hardly any time, these are not travelers, hardly any time for them to transmit it. And so you'd have, and then when they got to care, it was either late or the care was poor. So the death rates were 80%, 85, 90%. However, even with some of those earlier outbreaks, I'm talking, 1980s, 1990s, and they would happen in DRC, in Sudan, in Uganda, in Gabon. The death rates, if you look closely, you would get some 60%, some 55%, and that's still with relatively poor care and with all those circumstances that I've mentioned that mitigate against surviving. So when you come and look at what is happening here in Nigeria, although it's a very small number and you can't really talk about survival rates reliably, but we're around 30%, 34, 35%. So if you do have it, your best chance of surviving is quick medical treatment. Not with a cure. We don't have a cure for it, but it's supportive treatment. You can have a drip, you can have a fluid. One of the problems is dehydration that helps your system to shut down and for the virus to invade even more swiftly. So, things like pain relief, blood transfusion, fluid transfusion, nutrition, all those things will help your body fight the virus. So if you are worried that you have had contact, the worst thing to do is to hide away and hope that it will go away. It's better to, cope with the discomfort of being in isolation
and not to go to prayer houses or...
That is the worst thing to do, because you probably infect your pastor and other people while you're there as well. And, like somebody said, God does miracles, but let him do the miracle in the isolation unit. So just come to the health system.
Okay, I just want to add this. The National Council on Health gave the directive that corpses, movement of corpses, should be regulated. Don't just move a corpse without a death certificate. Yeah. But it would seem that some of the states are not complying with this. Tell us about Ogun State and the risk in this, in non-compliance.
You see, this is why public health is so difficult. I'll give you an example before I come to the corpses. We've had to tell people to stop eating bushmeat. But the average hunter or villager or even commissioner will tell you that he's been eating bushmeat for a long time and he hasn't got Ebola, and neither have they. But since we know that in other countries it happens, it will be irresponsible of us to say otherwise. And it's the same with the corpses. Right now, if there's no Ebola in Ogun State, then even if there's a corpse that died and we don't know the cause of death, the likelihood of it being Ebola is very low. But since we know that even a corpse, the body fluids can transmit Ebola, it will be irresponsible of me to say to people, well, don't worry, the risk is low. We must try and just discourage. And the idea is it's a dragnet approach. It's like if there is one within all the hundreds of dead bodies that are being moved around, if there is one, by banning that movement, we'll at least stop the movement of that one. And that's really the aim. So we urge people to just try and comply with it. The simplest thing to do is make sure you go get the death certificate. It's not likely to be Ebola, and if we can get the death certificate, then everybody is happy. But if you have one corpse that has died, unfortunately, from that, maybe somebody who just came back from Liberia died suddenly at home, and they say, I'm going to go back and bury them in the village, you could cause a disaster. So it's not worth it.
So would it be more appropriate to work with mortuary attendants?
Oh, yes,
so that
absolutely.
They don't have to, they affect the compliance even right
at that level. Absolutely, yes, yes.
Okay, let me have the final question then, and that will be the issue of medical doctors. You're a medical doctor, and they're still on strike. What will be your word to them, especially in the face of Ebola? That will be the final word now.
Well, I wouldn't mince my words. I think it's been a sad outing for the medical profession. I think the NMA missed a major opportunity to gain public support and to show that the humanitarian calling is uppermost in their minds. And I do think that they are going to have a rethink, and I pray that very soon that strike is called off. I think there's no excuse. I don't know what they're waiting for. A nuclear war? You have a national emergency, you have a public health emergency of international concern as announced by the WHO, and you don't think that's enough reason to suspend the strike. Suspend. Nobody's saying cancel, they're saying suspend. Let's get this Ebola over with, and then we can go back to the negotiations. They couldn't bring themselves to do that. There's a lot of politics, medical politics behind it, but I will not mince my words. I'm disappointed and very dismayed about how my colleagues have behaved. And I will say that I don't believe it's representative of the average medical doctor in Nigeria. I think the medical politics has been hijacked by maybe some people who are a bit more hardened, a bit less humanitarian in their approach. And I think they have made us all doctors look bad. I think it's a very unfortunate. But I do detect that there's a move, and of course nobody's sitting still. Everybody's still talking behind the scenes, and I think.
Would you say federal government suspension of the residency training is in the right direction?
I don't want to get too deep into this, because if I start talking, I'll get myself into trouble. Frankly, I think it will help in the long run. I think they needed a wake-up call. In the short term, yeah, it doesn't look like a helpful move, but if you knew the politics behind, then you would understand why that has happened. So on the surface, it doesn't look like...
Is that a tit for tat then?
It's a wake-up call. It's a wake-up call. Not a tit for tat. No, they're not playing that kind of game. It's a wake-up call, and I'll leave it at that.
Okay.
Thank you so much for coming this morning. We've been having a chat with the Commissioner for Health in Ogun State, Dr. Olaokun Soyinka. Thank you for coming on this morning.